Well, hi everyone. Thanks so much for joining us for another episode of Ask a Doc here at HCA Florida North Florida Hospital. Today we have a very special guest. We have Dr. Frank Macedo, who is a surgical oncologist here at HCA Florida North Florida Hospital. Thanks so much for joining us today.
Good morning, Lauren. Good morning, everybody.
Yeah,
Good
we're
to
so
be back.
excited you're here. It's your third time on Ask a Doc. You're a veteran now.
That's right. It's always good to be here.
Third time's the charm. You need a little badge that says I've been on Ask a Doc 3 times.
That's right. That's right.
Well, Dr. Macedo, today we're going to talk about esophageal cancer in honor of April being Esophageal Cancer Awareness Month. So we're so excited to talk about this topic. Before we get started, we want to let our audience know if you have any trouble hearing us, go ahead and let us know in the comments. And also, if you have any questions for Dr. Macedo, this is the time to ask him. It can be, in reference to what we're talking about today, or it can be in reference to anything in the field of surgical oncology. He is here to help answer your questions. So I'm going to pull up our live feed here on the hospital Facebook page here in a minute, and I'm going to be keeping track of your questions. This looks good. We look pretty good on Ask a Doc today, let me tell you. So, Dr. Macedo, before we get started and into the topic today, you've been on here a lot. Everybody seems to know you. But for those who may be new and joining us today and new to you, Dr. Macedo, go ahead and tell them a little bit more about yourself.
Thanks, Lauren. Thanks for being here. It's always a pleasure to be here and then outreach to the community and be able to explain a couple of the conditions and treatment options we have here at the hospital. For those who don't know me, I'm Frank Macedo. I'm a surgical oncologist. I joined the cancer program here about 4 years ago, and we have been doing all this interaction with the community, especially during COVID, and now doing much better in that regards. But I have a broad-based practice in a number of GI cancers, cancer of the colon, rectum, gastric cancer. We see unfortunately, a lot of pancreatic cancer at the hospital, at our cancer center, and also a lot of upper GI cancers like esophageal cancers.
Okay, very interesting. So, today we're going to talk about esophageal cancer. And again, April is Esophageal Cancer Awareness Month. So, to start, go ahead and tell us a little bit more about what is the esophagus and what is its function?
Yeah, that's a good question to start, Lauren. So the esophagus is something that we hear, but we don't, usually the general population, they don't have much knowledge about it. It's basically a muscular tube that is sort of squeezed between the lungs and behind the heart, and then it connects the mouth to the stomach. It really does not have any absorption, but there's a lot of function with the movement of the food from the mouth to the stomach.
Pretty essential.
That's exactly right. So
Yeah.
esophageal cancer, it's usually starts on this inner lining of the esophagus, and then that's when the tumor grows. It spreads outside to the lymph nodes, and that's what we're going to talk about a little bit later.
Absolutely. So let's go ahead and can you talk a little bit about, let's get right to it, the cancer of the esophagus. I can't even imagine. I mean, that must be so difficult for patients, but go ahead and tell us a little bit more about it.
Yeah, Lauren, you nailed it. So it's actually pretty difficult, and the symptoms can be a little bit late. Usually patients present, the most common symptom is they have difficult swallowing. And then usually this is a progressive symptom, so they just don't stop eating all of a sudden. They actually start difficult swallowing, especially solid food, steak, bread, and then as the time goes by and they notice that really affects their quality of life, it can be too late. So that's very important what we're doing today. So if anyone is having issues swallowing liquids, water, losing a little bit of weight unintentionally, it's very important to talk to your primary doctor or even surgeon about it. So the esophageal cancer it's very common in the East, actually in Asia, China. We have what we call esophageal cancer bout, Iran, and Japan. It's very common. Here in the U.S. it's not that common. It's about the 10th most common type of cancer, but it can be very deadly. So it can be actually sixth most common type of cancer-related death in the U.S.
Wow.
What is important to understand is that there has been a 700% increase in the incidence of esophageal cancer over the last 3 decades
Wow.
because of smoking, because of diet, and all that. So there's a big problem. We're seeing more and more this disease in our communities.
Wow. And there's a couple different types. Can you talk about that?
Correct. So there are two main types, and then they behave a little bit different. There's the first type is called squamous cell carcinoma. It's mostly common in the upper esophagus and the mid section of the esophagus, whereas the second type called adenocarcinoma is mostly common in the junction between the esophagus and the stomach. And that's the most common type that we see here in the United States.
So you talked a little bit about those risk factors for esophageal cancer, but can we dive a little deeper into that? Can you tell me a little bit more? And we talked a lot about the symptoms, but I've read that reflux is also is a risk factor. So talk a little bit more about that.
Yeah, that's a good question, Lauren, because this is really what the patient should be aware of. So one of the biggest problems with esophageal cancer and the risk factors is reflux, which actually a long-standing disease. Not everyone has reflux will eventually lead to esophageal cancer. Very important to note that. But of those who have reflux, it's very important to get a consultation with a GI doctor. We, by the way, have a great GI doctors here at Digestive Disease in the hospital. So to have an endoscopy and then see what's going on, change diet. So reflux can lead to a condition called Barrett's esophagus, which is basically a precancerous condition that can increase the risk for esophageal cancer by up to 60%. So that is, it's very important to be aware of that. And then any patients who have reflux should be treated with a acid suppression and then to be checked and consulted by a GI doctor. Other risk factors, smoking, obviously related to esophageal cancers, especially squamous cell carcinoma, older age, male gender is a risk factor, African American is a risk factor, and also being overweight and obesity and the food that you eat is related to and alcohol consumption is a risk factor for esophageal cancer.
Absolutely. Well, Dr. Macedo, let's go ahead and take a little pause and thank everybody who's watching today. This is fantastic. Thank you all for tuning in. If you have a question for Dr. Macedo, go ahead and type them in the comments. I'm watching the feed right now, and I'm keeping track of those questions. Because now's the time. You have Dr. Macedo right here, a captive audience for you. So go ahead and type your questions for Dr. Macedo, who is a surgical oncologist here at HCA Florida North Florida Hospital, in the comments, and we will answer them live here on Ask a Doc. So let's go ahead and continue with that conversation, Dr. Macedo. We talked a little bit about the symptoms. So what happens, and you talked as well, if people have reflux. But if they have these symptoms of difficulty swallowing, weight loss, all those things that you talked about before, what should a patient do?
Yeah, so the very important thing is to usually how the process works as you are seen by a primary care physician, family doctor, and then with those symptoms, it's the patients are referred to a gastroenterologist, a GI specialist, and then that's when the discussion about diet changes and how long are the symptoms, if there's any really red flags like painful swallowing. Painful swallowing it's not related to only reflux. So if you're having issues when you swallow, you have pain, that's a red flag. You definitely should have an endoscopy. So after they are seen by the GI doctor, and then we can actually see and undergo an endoscopy, which is basically a camera that is really a 5-minute procedure. It's a camera that goes to your mouth while you sleep, and then able to actually see the inner side of the esophagus and the stomach, in that way to find any potential issues there is.
Wow.
And then biopsy, and then will lead to the diagnosis. After you have a diagnosis, then you are referred to either a surgeon like myself, a surgical oncologist, or a medical oncologist or a radiation oncologist, because as we will explain later, the treatment for esophageal cancer can be quite complex and definitely multidisciplinary. So,
What's the prognosis for someone who has esophageal cancer?
that's a great question. So the prognosis, as any other cancer, it will depend on the staging. So that means that after the patient receives a diagnosis, a positive biopsy, they will undergo what we call a staging workup, which include a PET scan and sometimes an ultrasound of the esophagus. That will determine where the patient is, either stage 1, which will be the best, or stage 4, which unfortunately will be the one that is when the cancer had spread to the other organs. So up to stage 1 and 3, there are chances the patient can be cured, whereas in stage 4, we are looking for more palliation. So we try to, that's why it's important to be seeking care and looking for these things early, because the sooner you know that, the better we are able to help you and then get better results. The prognosis for stage 1 can be quite good if treated, sometimes either by endoscopic removal of these tumors. Patients can, there's a 5-year survival up to 90%. When we move along to stage 2 and 3, that dropped to about 60%. But if you look, Lauren, this is still much better than other cancers like pancreatic cancer that has a much lower survival than that. So even being aggressive, finding the right team, you can get good results. And then when you move to stage 4, the outcomes are much more dismal. We are looking, median survival a year or so. But there's some excitement even in that patient population. There's some new treatments that we're going to talk about later.
Oh, that's really
Yes.
exciting. Dr.
Mhm.
Armacito, that's fantastic. So can you talk about the treatments for esophageal cancer? Because as you had just mentioned, we've seen a dramatic change in those treatments.
That's right.
We want to learn more.
Absolutely. So it's the treatment again for esophageal cancer will depend on the staging. So for stage 1, when these tumors are found early, there's even a chance that the patient will not need any chemotherapy or surgery or radiation. Even an endoscopic resection can actually be associated with cure, can lead to a cure in these patients, but that has to be an early stage tumor. We actually, I'm happy to say that our partners here at DDA, Dr. Pertoni and Dr. Brott, they actually do this procedure, which is done in only a few places here in Florida.
Wow.
So we are able to provide that here in our hospital. It's part of our complex cancer program. And then when you move along, Lauren, stage 2 and 3, we typically combine with chemotherapy and radiation before the surgery to downstage the tumor, and then eventually the patient would get surgery to remove that esophageal mass.
Gotcha. Well, this surgery for esophageal cancer sounds so difficult and intriguing. Tell us more about that.
Yeah, so because the location of the esophagus and being, not 70% of the esophagus being in the chest, is squeezed as I can by the lungs, by the heart, spine. There's a small section in the abdomen where most cancers in the esophagus here in the U.S. happens, and there's also a neck portion of the esophagus. But because of the location, makes the surgery very difficult to do. So that's why you need special training and special skill sets. But the surgeons, they do very well because before the surgery, they are really unable to eat. As I said, one of the problems is you're not able to swallow food. And after the surgery, the patients start eating again. So we restore the quality of life. But the surgery can be done in multiple ways. There's through an incision in the abdomen, in the neck, or incision through the chest. The surgery can be done robotically, minimally invasively, or open. So it depends on the location, depends on the size of the tumor, the lymph nodes, all that is part of the surgical plan. The recovery is a little bit long. It takes a full month to feel really good again. You know, hospitalization stay varies between 6 and 7 days in general. And then, but again, as I said, the patient really, after that recovery time, they feel that the quality is back to their lives.
Oh, that's fantastic, because
Mhm.
that's really, it's so important to someone going through, you know, cancer
Mhm.
treatment. So talk about why it's so important to have this done at a center that does a high volume, that is, you know, like here. I mean, you are extremely good and have great quality in your cases. Why is that important to select that?
So that's a very good point, Lauren, because really quality is it's really linked to volume. So the more you do, the better you get, and not only the surgeon, but also the team. And then we're talking about a team of nurses on the floor, the OR nurses, the staff, which by the way, I want to open this page to thank all the nurses in North Florida who do an amazing job for our patients, and I'm really grateful to work with them. But so the whole team gets better. You know, not even just the surgical part, the planning from the chemotherapy, the radiation, at the Florida cancer specialist. So everybody works together, and then so we got to know more and more about it. So I'm happy to say that we are a high volume esophageal center. We do surgeries for esophageal cancer every month, multiple times a month, and then so the patients have better outcomes in a place like that. Also, nutrition is very important for these patients because they can't eat before the surgery. So having a good team of dietitians, nutritionists is really a key portion of the whole program. So definitely volume translate in quality.
Absolutely.
Yeah.
Well, Dr. Macedo, I think it's time that we go and take some questions from the audience. So if you guys have any questions for Dr. Macedo, go ahead and type them in the comments of the live feed. We're keeping an eye on that right now. Thank you so much for tuning in for another episode of Ask a Doc here at HCA Florida North Florida Hospital. All right, Dr. Macedo, a couple of questions that have come in they said, Dr. Macedo, what is going to happen to my quality of life after surgery for esophageal cancer? What would you say?
Yeah, that's a great question. So the surgery also, in the first month, it really affects your quality of life, and that's why we have to have very frequent visits in the clinic to detect any potential issue after the surgery. Nutrition is so very important for patients because initially after these operations you just can't eat. You cannot just go eating nothing to go to eat regular food. So there's that time that you need to adjust. You need to relearn how to eat, and how teach your body how to tolerate those foods that you're not able to handle for so long. But that takes a good time. But after that is bridge, and after we go through that recovery process, I've seen patients in restaurants. I've seen patients coming for long-term appointments, really able to have a really close to a regular diet, and that's very very satisfying to see that. About pain management and those things, that something that we work side by side with the patient to get their recovery as quick as possible.
That's awesome. Thank you, Dr. Macedo, and thank you so much to our viewer who submitted that question. That's fantastic. Thank you so much for watching today. All right, so we're taking questions for Dr. Macedo. Go ahead and type them in the comments of our Facebook Live feed right now before we go ahead and sign off here in a few minutes. So get your questions in. Don't sit on your questions. All right, so Dr. Macedo, the next question that has been submitted is from another viewer, and they say, Dr. Macedo, I've had esophageal cancer surgery, and so what's the next step for me? Is there any treatment that I might need in the future?
Yeah, so one good thing that happen is that most of the treatment happens before the surgery. We call neoadjuvant therapy. So that is a combination of chemotherapy and radiation. So usually after the surgery, there has not been actually treatment until recently. There's just very new landmark trials that just came out about 6 months to a year ago, showing there is actually improvement in recurrence-free survival. That means basically decreasing the chance of coming back.
Wow.
With the introduction of immunotherapy, which is relatively new. We talk about immunotherapy for other cancers like melanoma, for example, but very few people know that actually immunotherapy works after the surgery in patients with locally advanced esophageal cancer. Immunotherapy is different from the chemotherapy. It's a completely different modality that is offered also by the oncologist, and then it's a different mechanism in which usually is associated with less side effects. But now we know that now there's treatment option after the surgery to prevent the cancer to come back. So this is actually pretty interesting, and then we are seeing more and more patients eligible for this treatment modality.
That is fantastic news.
Yes.
And so I don't see any more questions submitted for you. I do see a lot of people chiming in saying how amazing you are.
Mhm.
So that's fantastic. Thank you guys so much for watching and supporting Dr. Macedo today. That's fantastic. But Dr. Macedo, my closing thoughts to this presentation today is that you have all of the information you've provided with us today. There is hope for these patients. I think that's the take-home message. So can you go ahead and wrap it up for us today and really give a message to someone who may be going through this, who may be starting their journey with esophageal cancer? What is your message to them?
Yeah, thanks, Lauren. I mean, thanks for the opportunity again. I'm really blessed to be here, work with the team that we have, and then the community. Thanks for everyone's comment. Sometimes I say I don't deserve this much kindness, but I will tell you that we really work hard at our cancer program to improve the patient's quality of life, restore their hope, and sometimes achieve cure and give that hope back to the patient and their families. It's really when someone comes and is diagnosed with cancer, their life stops and they put everything aside because there's so much questions about how they're going to do after. It's not only the patient that struggles; the whole family struggles. So we don't take it lightly. And when the patients come here is diagnosed with any type of cancer, especially esophageal cancer, we sit down with the patient, explain these issues, staging, prognosis, treatment options, and restore their hope and explain that we're going to be with them, helping them out in their journey, because it's really a journey. And then what I usually say patients is this is not a sprint race, this is more like a marathon. So we have to pace ourselves, take one day at a time. And then one thing that I assure patients is that we are North Florida, at the cancer program that we have here, we can assure you that you would be treated really as a family member. We would we don't take it lightly because we want the best for that patient. So again, I'm just happy with everyone's comments, but I'm especially happy to give that hope back to the patient and then achieving cure. That's what we're looking for.
Dr. Macedo, we are absolutely honored to have physicians like you practicing here and helping our patients. Thank you so much for joining us today and for helping us with this community education. We really appreciate your time.
Thank you, Lauren. Thank you, everybody.
Awesome. And thank you guys so much for joining us for another episode of Ask a Doc here at HCA Florida North Florida Hospital. We'll see you next time.